Hello, my name is Katie Jo. Thank you so much for clicking on this video and watching it today. Before we get started, I wanted to put in a disclaimer that if you are a child or under 18, that parental guidance is advised. And if you're the one that clicked on this, I am going to be discussing some pretty heavy adult matter topics. And so I just wanted to let you know, and you might want to skip to another YouTube video. So if you're an adult and you're interested, you can see by the title that it's about a surgery that I had. And yeah, so that's that, and let's get started. So when I was a child, I was born with a heart murmur, and so I had been followed by cardiologists since I was born. But other than like knowing about that, I guess, I never really felt that much different than the other kids that were my friends and that I played with. The only thing looking back that I can recall is sometimes when I would run, I would feel like cold air in my lungs and it kind of stung. But I thought that was normal for like it to hurt a little bit. Anyway, and also the minute that I would get to jogging or speeding up and trying to run, my legs would get what I call jelly legs. So they would get quite tired pretty fast, and it just kind of like felt like the muscles weren't in my legs weren't keeping up with the rest of the muscles in my body. I'm about 7 years old, and we had switched to another cardiology visit to have my heart murmur looked at. And when I went in, my blood pressure was a little high, and they decided to do a blood pressure check on the lower half of my body. And when they did that, the blood pressure in the lower half of my body, I guess, was lower than what it should be. So he ordered this test where they put like a device inside an artery in your leg, and they run it up into the bottom part of your aorta, or the main heart valve that pumps blood down to the lower half of your body. And they pushed it up so that they could get a good look at my aorta. I don't recall much of that experience, I think because I was either under anesthesia or twilight medicines or whatnot. I did that test and I came home and went to school, and I was coming down the hill from our bus stop with my brother that's closer to my age, and we were playing like tag, you're it, or I'm gonna beat you kind of race. We were racing down the hill, and all of a sudden my older brother, who I believe was in junior high, maybe going into high school at the time, he came down the hill and he was like, "Katie, the doctor's on the phone." He either said something like, "It's bad, or you're gonna die," or I don't really remember what the exact words are, but he was in an utter panic. And even at that age, I kind of understood the gravity of it, but like any human being, I think I was a bit in denial. So I was like, well, he must have misunderstood something. And I walk in the house, and my mom's on the phone with the doctor, and she's just in tears and freaking out a little bit, I guess you could say. And it was that moment that I realized, okay, something really is going on. This isn't good. I knew that I was going to have to go to the hospital, and I knew that it was going to need to be soon. And my parents explained to me that basically they gave me the general overview, which was that I needed to get my heart fixed. But I didn't understand like the full details, of course, till I actually went to the hospital. But they gave me the general rundown of what was going on, and that it wasn't working right and they needed to fix it soon. It was in the winter time, so I got to have Christmas and New Year's at home, And my mom had bought me a little stuffed bear that was red and white. It was so cute. I think I have a Christmas picture. If I can find it, I'll put it in here. But it was a Christmas bear, and inside it had a little working heart that had a battery, which was pretty innovative at the time, by the way, because we didn't have Build-A-Bear back then, I don't think. And its little heart beat, and I got that on Christmas Eve. So I remember thinking, like, this is cool. I'm going to have a good heart like this bear. So January comes and my birthday happens, because my birthday happens to fall in the month of January. So about this time I turn 8 years old, and I get all packed up to go to Children's Hospital, which is where I had my surgery happened. When I get to the hospital, I find out that the full gist of like what was going on. So I had a muscle that was wrapped around the main valve that pumps blood to the lower half of your body. It's called the aorta, and the technical term for a constriction like that is coarctation of the aorta. And what happens is they have to fix it, or your body's not going to circulate the blood properly. And so I had to get it fixed. So they explained to me that they weren't going to be doing open heart surgery, which was good news as far as like the recovery time. But they weren't 100% sure at the time if they were going to be using a standard procedure where I think it's called angioplasty. Correct me if I'm wrong. But it's where they put a device inside of the aorta, and they have like a little balloon, and it opens up and stretches the aorta. Or the other option was just cutting the muscle, which at that time was pretty revolutionary to be able to do that without opening me up from the front. So they did what they call closed heart surgery, which was pretty revolutionary at the time. There wasn't any like kid books on it, or they used to give heart patients these coloring books that explained normal procedures, and I remember they didn't have one for closed heart surgery. So what they did was and I'll put in a picture of my scar, but they went in from my left shoulder blade all the way to the middle of my side or spine. It's about, I can't see, about this long, I think. It's really long. And they went in through the back. So I get all checked in, and I remember bringing my friend's elephant that she gave me as a gift for my birthday in. Big, huge, like giant stuffed animal, because you could bring just one. So I brought the biggest one I had, and they put a little red band, hospital band on the stuffed animal. So that was pretty awesome. So I get checked in, and the hard part about the pre-surgery was just they did a lot of the testing like in the middle of the night. So I remember being like so tired, and they woke me up at like 2 or 3, and the nurses were apologizing and everything, and they would let me nap while they put like this EKG, little EKG stickers on my chest to test my heart. And every once in a while they would roll my bed and did different like diagnostic tests before the surgery, and but they were like really odd hours. So that was the only thing that was hard about that. I remember that there was other sick kids, and then they put so the morning of surgery comes, and they put a IV in my hand, before they wheeled me down to do the general anesthesia. So for some reason, when they put the IV in my hand, I just remember falling asleep. I don't know if it was like just a reaction to the needle going in, or because obviously at that time I wasn't as used to needles and stuff like that like I am now with all the doctor's visits that I do as an adult. Anyway, so I don't know why, but they put the needle in and I passed out, and then I vaguely remember the anesthesiologist sitting on my bed and explaining that I was going to be sleeping through the whole thing. And and I remember them having me saying, "Can you say the alphabet backwards?" And I started laughing, and I was like, I can't even do the alphabet forwards. Oh Lord. So we had a laugh, and then I was asleep. And the next thing that I recall, so I guess I was asleep for quite a long while because it's pretty intensive surgery, and the one that they ended up doing was they went in through the back, the closed heart surgery, and then they actually cut the muscle that was wrapped around my aorta to give it the best option for growth as I aged, I think. I think that's why they did it, but basically it expanded the ability for blood and the volume to get through the aorta. So that was the procedure that they did. I remember them waking me up and telling me about that. I still had a breathing tube in. It was the kind that's like actually surgical and it goes through your side, but I was so tired and groggy that I don't actually, when I woke up, I remember a little bit of the conversation, but I don't remember the tube being there till later. So then I guess it feels like I slept for another 24 to 72 hours, I want to say. I don't think it was 72 hours, but in a kid's brain, it felt like 3 days. But when I woke up for the second time, I remember, this is so silly, but I remember like being angry. And that's silly because I'm in a hospital. I survived. I should be grateful, blessed, happy. And I was, but I was confused and a little angry because I don't know if it was the medicine or whatnot, but I think I was prepared for what they were doing, and I fully understood as much as an 8-year-old could, but I wasn't prepared for the crushing pain. To be honest, it felt like I'd been hit by a Mack truck. And I think I remember even saying or describing that. It was like, I feel like I've been in an accident. So, yeah, it was bad. But I think they were able to kind of control my pain a little bit more in the next couple of days without, control the pain without me being too groggy. And the next couple of days, I slowly remember being more cognizant of my surroundings and more aware and talking with the nurses. And I remember the nurses coming in and like wanting me to like transfer into the wheelchair and kind of like pushing me to roll into the bathroom and that kind of stuff. Just wanted me to get up and get mobile. I didn't know why it was important, but they did, so that's good. So I remember that. And so yeah, they got my pain under control. And then the only really, really hard part after that was a doctor came in, the doctor who was like on the cardiology wing, had been keeping up with the care of my chest tube that was placed, I don't know if it was a chest tube for breathing or a drain tube, but I have a scar here on my left side of my pectoral muscle. And I remember he said to my mom, like, you might want to step out of the room for this. And I thought it was weird, but I didn't really know what was coming. Hold on, break. Whew, heavy. So, I don't know if they can't, like, I'm not a doctor, you know, obviously. I'm a patient. So I don't know if they can't give you certain medicines that decrease your respiration rates or whatnot. But I remember he was basically like totally straight up and honest, and he's like, this is really gonna hurt, but it's only gonna be a second. Let me tell you, to this day, I still do not recall anything that painful. It was so painful. And I know it was just as hard on my mom as it was on me, because I'm sure she could hear me. But so that was not a highlight of the experience. But anyway, but the good news is because I was getting it out, that meant that I was getting through the first hurdle of the recovery process. Saying like, oh, you're breathing so good, you're doing better, you know, it would be good if you'd go for a walk. And I was just, oh, no way. It wasn't like I was in a whole ton of pain, but there was just so much sleepiness involved, and I just was a little grumpy, which I find out as an adult later, of course, that that's actually kind of normal to be a little grumpy or a little bummed after that kind of heart surgery. So they kept bothering me to do that in a nice way, and I kept politely declining. And then I remember this one sweet brunette nurse, probably only in her 20s. She comes in and she was just like, had her hands on her hips, and she was turning her head, and she's like, you know, you really need to get out of bed. And I was like, nope, not gonna happen. And they kept wanting me to go to the playroom, and part of me not going as well was because I was still really shy, and for some reason I just kept feeling like I had such a unique procedure that the other kids couldn't really relate. And I think I was also kind of scared to witness other kids that were unwell, and I was worried about some of them even though I didn't know them. And so I really didn't want to like go to the playroom, I guess, at that point. I do remember she was like, well, it doesn't matter where you go, but you've got to get out of bed. And this was probably about somewhere between 3 to 6 days into my recovery. So I was like, fine, I'll go. So my mom says, well, I can push the wheelchair. Where do you want to go? So the nurse and my mom get me into the wheelchair, and my mom starts pushing me, and she said, do you want to see the babies? And I was like, well, yeah. So they took me up to the NICU where they had all the little babies, and I got to see the volunteers holding the babies that needed to be fed. I still remember that so vividly. They were so cute. And I also saw other kids that were born with heart defects, and that was the first time that I realized, like, there are other people that might be able to understand me, and these kids are gonna, you know, have some challenges, but you know, they can survive. So like, and some of them are surviving, so maybe I could. And it just kind of lifted my spirits. And then a couple days later, my school teacher came to visit, and she was so cool, I can't even express. how amazing this person was. Visited me, and she brought me one of those Fred Meyer's teddy bears. And when she wanted to go to the playroom, that's when I finally accepted that I needed to like try to walk and move around a little bit. And they were having some kind of show, which is awesome that Children's Hospital does that. And she came to the show with me. And I don't really remember the show, but I just remember her being there and just feeling like I could do this and that I might be okay, and that it wasn't just my family that cared, but there was other people that really cared too. So that was pretty cool. And as every day passed, I got a little bit more and more awake and needed pain control a little bit less. And I was so tiny, like I come from a tiny family, so that part's not, you know, too surprising, but I was even a little bit smaller than some of the other girls in my family. And they still had up like the crib rails of my bed for pretty much my entire duration of the stay for my safety. And I remember the doctor came in and I was chit-chatting with my mom and my dad, and I was like climbing on the rails of the bed, almost doing gymnastics. And he looks over at my parents and he's like, I think she's feeling better, like I think she can go home. And so it was about 2 to 3 weeks that I spent there. And the funny part about it all was I specifically remember that one of my favorite foods as a child was chicken noodle soup. Oh my Lord. And on the menu, every day I got to pick out the different kinds of food that I wanted to eat. And on this particular night, but you had to choose from like a few different kinds, and it would change every day. So on this particular night, it was chicken noodle soup night. And I was like, oh my God, I'm so excited. But then the doctor said I could go home, and I was like, but I don't get my chicken noodle soup. So all the way home, I was like, I want my chicken noodle soup. I want my chicken noodle soup. It's chicken noodle soup night. I think I drove my parents crazy. So, but I was excited to go home, mind you. I was very excited to go home. But yeah, I wanted that soup. And we get to the house that I lived in at the time had a few stairs and then a plateau and then the long stairs up to our kitchen. So the outdoor stairs, there was only a few of them. And I remember getting out of the car like normal and walking up to the steps, not even like thinking about everything that my body had just been through. And I go, thank God my dad was standing right behind me, but I go to step up on the first step, and it was like somebody had just put a door on my eyes. Like everything just shut down. And he caught me, and he was like, whoa, Katie, you just almost passed out. And I was like, well, that's strange. But looking back, it kind of makes sense, because I didn't, while I was in the hospital, I didn't do a whole ton of, you know, walking around. Plus the nurses are really nice, and they like let you ride on the IV pole, the base of it. It's pretty fun. So that happened. But, so yeah, that was the first night. And then I remember just kind of feeling a tiny bit flu-like or feverish, which thankfully I didn't actually have the flu. It was probably just slowing down of certain medications, and my body was kind of like a little bit in like withdrawal, or it was a new heart pill they put me on, and I'm not really sure, but I felt a tiny bit flu-like. And so I remember laying in my mom's arms, and she was like feeding me these salty French fries, and it wasn't something that I ate very often, mind you. It was so good. And yeah, so the next few days I kind of spent in bed watching a lot of movies, just kind of hanging out. I got a lot of attention, a lot of chicken noodle soup. It was pretty great. And a few days later, I remember I wanted to test out my legs and see if I still got that jelly leg that I was talking about before. That's what I called it anyways. Where my muscles would get really tight and slow. And I wanted to see if that still happened. Like if my legs still hurt. And I remember I was out in the back lawn, and I wasn't supposed to be doing this quite yet, but I was jogging around, and it felt so good. Like, for the first time, I was normal, and it blew my mind because I didn't even really know that I wasn't normal. And I remember my mom was on the phone with the doctor at the same time I was attempting to jog around, and she's like, told him what happened, and he's like, I think she's gonna be okay. So I remember that vividly, and I remember thinking, like, this is gonna open up a whole new set of opportunities and a chance to grow better and live better. And I still knew that I had a period of recovery in front of me, of course. It didn't, like, I didn't go back to school for a couple months and all that. So I knew it wasn't going to be an easy road, but that was the moment where I realized, like, the road might be a little better than it obviously would have had I not gone through with that emergency surgery. I definitely wouldn't be here this many years later. I still do have some heart defects, just for future reference, or if I ever mention it in other videos that I make going forward, but I still have what they call left ventral septal defect. So I still have a small hole on the left side of my heart, and I still have a bit of a constricted or narrow aorta, or the main valve, and that is called aortic stenosis. So I still have that, and we monitor it every year, and I try to be as proactive as possible and go to all my doctor's visits, because one thing that I do remember when I was a child in Children's Hospital, the doctor had said, you know, we're gonna do this and you're gonna be okay, but you might have to have a second surgery by the time that you're 40. So yeah, so that's why I'm making this video. It's kind of, I can make a whole other video on what that feels like, but it's kind of a surreal experience to have this kind of like number hanging over your head, or this possibility. I'm happy to say that I had my birthday last January. I beat the odds, like, not just the odds and statistics that you'd find in books or the internet or those kinds of odds, but like my personal odds. Like, I'm doing slightly better than I would have planned. I try to eat healthy and do my physical therapy and all the stuff and take my medicine. I'm on 2, so that part's no fun, but I do as much as I can. And yeah, I mean, sometimes when people find out for the first time that this was my early life experience and that I still have defects, and they wonder what my lifespan would be, and I don't think anybody can really answer that. It's a hard question. So what I can say is, for now, I had my valve checked recently, and the hole in the aorta are stable, meaning, yeah, there's a problem, but I'm stable. And so that's good. That's like the best that I could ask for at the moment. And it was a really weird birthday, but I made it through it, and I'm still here, and I haven't had that second surgery yet, so cross your fingers for me. But yeah, I mean, who knows what the future holds, but I'm just gonna keep doing my part because it's really all I can do. And I just wanted to share this story in case anybody knows somebody who has heart defects or has had to have surgery, or if you're going to have surgery. I just want you to know that you're not alone. So yeah, so I wanted to make this video to let you know that you're not alone in whatever health struggle you're dealing with. It doesn't have to be, you know, a major organ in the body or anything, but you're definitely cared for, and people care about you, and you do matter, and you can try to do everything possible to help yourself and help your odds and put in your physical therapy and take your medicine and treatments, but you're human and you're not perfect, and you can't expect perfection in a situation like that. And be grateful for every moment that you have and every opportunity that you're given, because none of us are guaranteed that, and life can change. It can change quickly for the better, and everything happens for a reason, and you don't know how strong you are until you're put into a situation where you have to show your strength. And you can be a survivor, and I'm no different than any other child who had been through something like that, and I'm no different than any adult who has to still continue to take care of themselves. It's something that we can all do, and you should be proud of the part that you're putting in and what you've done to survive. Yeah, so that's basically all I wanted to say. I wanted to share this video just to let others out there know that may have had similar circumstances that you can do it too, and I wish you all the best. Okay, so that's the video today. I love you guys so much. Thank you so much for watching this video. Don't forget to like, subscribe, comment, you know, or don't like, you know, it's up to you. It's free world. Hopefully if you're watching this video, you're an adult, so you can do what you want to do. So yeah, leave a comment, let me know your thoughts, any challenges you're going through, anything that's going on, and I will try to respond. Send you a virtual hug. Okay, love you guys. Thank you so much.